I was the health commissioner of Indiana during the time of Ebola and during the time of Zika. One of the lessons learned for me led to my theme of better health through better partnerships. When we were trying to figure out our Ebola protocols, it wasn't just a matter of dealing with the infectious disease docs. We had to make sure everyone in the entire hospital was aware of what Ebola is and what it isn't, so that we could properly screen and take care of individuals without stigmatizing them, without discriminating when they came in the hospital. We had to engage our law enforcement community because often they're the first responders to a 911 call. So if they show up and a guy is having a heart attack, but they're scared to go in because he happens to be from Africa and they think he might have Ebola, which there have been cases of that occurred across the country, then that's going to inhibit care. We needed to make sure we were partnering with law enforcement, educating them continually, and making sure we're reaching out to the educational community. Again, looking at the Ebola situation, many of the folks who were coming from the countries that were affected by Ebola were coming to the U.S. to study here. They were colleges and universities. So we needed to make sure they were aware of risk factors and how to appropriately treat people without discriminating. But you know, the best way to treat Ebola is to make sure it never turns into an epidemic in Africa in the first place, so that it never gets on a plane and comes to the United States, so that we never have to deal with it. And so, again, partnerships very locally in the hospital and in the community, partnerships on a countrywide and regional level, and partnerships across the globe with a focus on public health are really what's going to help us ultimately prevent the next disease from occurring.